The following presentation is education for those having spine surgery at Memorial Regional Medical Center. Memorial Regional Medical Center is part of the Bon Secours Mercy Health System. We're located in Hanover County, and we serve Hanover, the surrounding counties, the City of Richmond, Northern Neck, and the Middle Peninsula. The services for this type of surgery are provided by our neurosurgeons and orthopedic spine surgeons. Your education materials. You will be given an education book in your pre-admission testing appointment that has information about your surgery. This information includes what to expect during the surgical process, pain management, and a medication log to help keep track of doses, a help at home log to ensure that you have the help you need when you get home, as well as information about nutrition and an activity guide to help you understand what you need to do after your surgery. Preparing for your spine surgery. Make sure that you are prepared and committed to the success of your surgery. You should prepare by choosing a coach or a helper to assist you after surgery. This can be one person or a few people that are going to be available to you after you get home from the hospital to help. This should be someone who is physically and mentally able to help you after surgery. You should arrange for care at home for the first several days and transportation as needed. You will not be allowed to drive until your doctor says that it is okay to do so. Things to consider prior to surgery. These are some of the things that you will do before your surgery. You will have the pre-admission testing appointment at the hospital. You will visit with a nurse who will review your medical history, your medications that you take on a daily basis, as well as giving you information about your upcoming surgery. You may visit your primary care doctor for medical clearance to be sure that you're healthy for this procedure. You should fill out your help at home log to make sure that you have available help when you get home after surgery. Limit your alcohol intake and be sure to drink your pre-surgery drink at bedtime the night before your surgery if you were given one by the pre-admission testing nurses. Not everyone will get these pre-surgery drinks, so if you were not given one by your nurse, then this does not apply to you. You can also prepare your home. You should clear walkways through your house and remove small rugs or cords that may cause you to trip when you get home. You can put night lights out for your bedroom and bathroom if needed to make sure you have a well-lit path to get there when it's dark. You could also stock up on easy-to-prepare foods so that that part of your care is easier for you once you get home. The day of surgery. On the day of your surgery, you should be sure to complete any skincare as instructed. Drink your pre-surgery drink if you were given one in pre-admission testing according to the instructions that they gave you. Take any medicines that you were told to take with just some sips of water and arrive at the surgery center on time. Bring your spine education book and your incentive spirometer with you to the hospital. The first place you will go is to the preoperative area. In the preoperative area, there will be a review of your medical information. They will start your IV, and your doctor will come to see you to discuss your surgery. He will confirm with you the surgery plan and be sure to answer any questions before you go back to the operating room. You will also meet with the anesthesia doctor to talk about the plans for you to go to sleep for this procedure. You will have a warming device placed on you, and you may take medicines in the preoperative area. Once all of these steps are done in the pre-op area, you will go back to the operating room. When you go to the operating room, your family members or the person that is with you for that day will be taken to the surgical waiting area. Your surgery. The portion of your book about your surgery provides details including the preoperative process, what to expect the day of surgery, what the procedure includes, and the postoperative care. You should read this material carefully to help you prepare for your surgery. The key to success is preparation. Be sure that you read through your book so that you understand what is needed before, during, and after surgery. Your coach or caregiver or family members can also review this material so that they have a good understanding of what will be going on during this process. While in the hospital, after your surgery is complete, you will go to the recovery room. Once you are more awake and your pain is controlled, you will go to the inpatient unit for care. You will have physical therapy or ambulate or walk with your nurse the day of surgery. You should expect to get up soon after your surgery. Ambulation is very important. When you are able to empty your bladder, your pain is controlled, and you're walking safely, you will be able to go home. Some patients will have surgeon-specific criteria, such as drains, x-rays, that will also impact your discharge plans. The inpatient nurse practitioner and the nurse taking care of you that day will discuss this with you. They will tell you any requirements for discharge and will go over your discharge instructions. Your coach or caregiver can be present for discharge teaching to ensure that all the information is understood. They will also give you a copy of your discharge instructions, sometimes called an after-visit summary here at the hospital, so that you have a reference when you get home of all instructions. Recovering at home after surgery. There is an activity guide in your spine education book to help you understand your movement after surgery. Remember infection prevention. This includes hand washing, controlling your diabetes, quitting smoking, and other measures to help prevent infection after surgery. Mobility is very important. Activity is important for your overall health. Be sure to follow any guidelines that you were given regarding your activity at the hospital. If you were given a brace for your neck or your back, you should wear it as instructed until the doctor says that you can stop. Managing your pain. Managing your pain will start in the hospital and will continue when you go home. At the hospital, we will use a pain scale. On a scale of 0 to 10, what is your pain number? First, we want you to understand that with this surgery, we do expect that you will have pain. What we expect is to manage your pain. The first thing we want to do is establish a pain goal while you're at the hospital. Your pain goal should not be 0. It should be somewhere between 0 and 3 so that it is a tolerable pain level for you. The key is not to making your pain go away immediately, but managing your pain until you're recovered from your surgery. You will take Tylenol every 6 hours to help with pain. We will also give you as needed pain medications, sometimes called narcotics or opioids, that will control the more moderate to severe pain. Always record your doses and check your record before taking more if you're confused about when you last took this medication. You should need less of these medications after a few days and take less often and a lower dose to gradually reduce the need. Be sure to wear your brace if your doctor ordered it. This could be for your neck or your back. They would have given you this in the hospital if they wanted you to wear it. Be sure to wear it until the doctor says that you can stop. Good nutrition to help healing. Be sure to put nutritious foods on your plate at every meal. Try to eat at least 3 nutritious meals a day starting before your surgery and for at least a month following surgery. If you are someone who does not typically eat 3 set meals a day, such as breakfast, lunch, and dinner, if you prefer to have 5 smaller meals per day, then that's okay. Just be sure that you're adding those nutritious foods to your plates. Good nutrition helps your wounds heal, which will help you recover faster from surgery. It can also prevent infection and give you the energy that you need for movement. Eat a well-balanced diet and be sure to include foods that are high in fiber, lean proteins, and vitamin C. You should drink plenty of liquids, especially water. This will help keep you hydrated, but will also help with constipation that is sometimes caused after taking narcotic pain medication. If you cannot eat, or if you feel like you're eating less than 50% of your meals, you can use supplements such as Ensure or Boost to help your body get the nutrition that it needs in the recovery process. Your mobility. Remember that you were made to move. When we say the word mobility, we're talking about your movement and activity. We expect you to get out of the bed with a physical therapist or nursing staff within a short time of arriving into your hospital room. The exercises that you were given should be practiced often. When you're in the hospital, you should call for the nurse or staff member to assist you to the bathroom whenever you are up. When at home, you should continue any exercises and get up and move at least every 2 hours while awake and gradually increase the distance that you go. Frequency is more important than distance in walking. You should gradually increase your distance as you recover from your surgery. Use any walker or crutches or wear a brace if you were given them at the hospital. Your activity guide will instruct you for your mobility or movement at home. It will help you understand what you should be doing and how much you should be doing at each phase of your recovery. Keys to success. You should get as healthy as you can before surgery and focus on staying healthy after surgery. Be sure to do your therapy, whether it's just walking every day or exercises as you were instructed by your doctor or therapist or nurse. Make sure you're eating nutritious meals every day before surgery and during the recovery period after so that you heal more quickly and prevent infection. Try to get quality sleep. We do not want you to take sleeping pills while taking the narcotic pain medicines. You should stay away from sick people and remember to frequently wash your hands to prevent illness and infection. You can shower starting the day you go home with clean towels and only clean clothes near your wound. You cannot take a bath or sit down in a pool, hot tub, or bathtub until the doctor says that it's okay to do so. If you have a dressing and it's waterproof, you can take a shower with it on. You just let the water run over it and pat it dry with a clean, dry towel. Be sure that you're taking measures to prevent falls. Make sure that you're walking on well-lit pathways that give you plenty of space to move. Try to inspect your wound at least daily or have someone take a look at it every day. And if you notice any changes, then notify your surgeon if you have questions. Warning signs at home after surgery. If there is a problem that you would normally call 911 for, if it is hard to breathe, if you're having chest pain, if you're having sudden weakness or difficulty speaking, if you have increased anxiety or difficulty when you're trying to breathe, or if you have changes in the sensation in your arms or legs with changes in your bowel or bladder control, you should call 911. If it is a problem that you would normally go to the emergency room for because it is a life-threatening problem, you will still do that after surgery. After your surgery, some things that you would call the surgeon's office for would be redness, heat, or sudden significant drainage from your wound, if your wound starts to look like it is open, if you have pain that is no longer helped by your pain medicine, or if you develop a fever, chills, new pain in your calves on your legs, or if you're unable to keep food down or liquids, you should call your doctor's office. Thank you for choosing Memorial Regional Medical Center for your care. If you have questions after watching this video, many of those answers are found in your spine education book. If there is anything that we can do to improve your surgery process, please let a member of our staff know.